So before we start, we want to make sure we acknowledge the land we're on. So LungSask is hosting this webinar from Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the homeland of the Métis. LungSask acknowledges that the many First Nations, Métis, and Inuit whose footsteps marked these lands for generations and reaffirm our relationship with another. So we know that many of you are participating on other land than Treaty 6 and would love to encourage you to find out a bit more about where you work and play and acknowledge it as well. My name's Jamie Peters. I'm a registered nurse. I've been with Lungs Saskatchewan almost 16 years, and I know a lot of you on the call. I've got a past background in seniors home care, seniors care and long-term care, but you know, my heart's here at Lungs Saskatchewan. We're the oldest charity in the province, and for more than 110 years, we've been in the forefront of improving lung health in Saskatchewan. Through these years, our commitment to continually improving lung health has fueled our passion to advance our work and serve you better. I think I've said this to a lot of you on the call before, but you've seen our new look and our new logo. We used to be known as Lung Association of Saskatchewan. We were known as Saskatchewan Lung Association. We were known as the Anti-Tuberculosis League originally. We're now known as LungSask, as you can see on our banner. And the logos and colors really reflect what we represent and the work we do and what our future looks like. So you can see there's a circle with lungs where your bronchial tubes grow from into a tree. The circle represents that interdependence of not only our lungs within our body, but with that all we do in research, education, care, advocacy, and everyone we serve in Saskatchewan and across Canada. Our lungs represent our reason for being, that which with we breathe, draw energy and sustain life. And our bronchial tubes or roots grow from the lungs that represent our growth and evolution in all that we do. Last but not least, the tree represents the strength of our foundation, our ability to weather any challenges, and our connection to the earth. So this brings new opportunities and to continue really to work on lung health, one breath at a time. And so I would like to find Mona, who's going to bring a quick message from our board of directors.
Afternoon, everybody. Thank you, Jamie. My name is Mona Eskis. I'm from Prince Albert, if you happen to read the chat on the way by. I'm a fairly recent member, or one of the newest members, I should say, of the board of directors for LungSask. The thing is, though, I'm not new to lung disease and lung problems. It started years ago with my dad, and he had pulmonary fibrosis, one of the choices here today. And what he did, and that's where I first learned about the pulmonary rehab, was because of him, because he went to the field house, or it wasn't the field house then, to the program faithfully, you know. So then, you know, time skips by, and no time in 2010, when I was diagnosed with COPD, it wasn't the doctors, I have to say, that mentioned it to me. I don't know everyone else's experience with that, but it was only because my dad had been part of it. And the gal that ran it, her name was Jazz, and it was an everyday name that Dad talked about her all the time. So I knew about it, and I wanted to find out more. So I contacted Nurse Jamie down at LungSask, or it was Lung Association at that time, and she gave me the necessary information I needed to get myself up and rolling with the pulmonary rehab program here in Prince Albert. So it was, you know, pretty tricky in a way to make time 3 times a week when you're still working full time, of course, but I was able to, and wouldn't change a thing. I'm so glad I was there throughout. Now, I wasn't there all the time. I mean, I tried, because like I say, I was still working full time. Now, moving forward in time, in 2018 was when I was prescribed oxygen for exertion. So the only reason, once again, I knew about the need for oxygen was because I was attending the pulmonary rehab program. And Robin, I don't know if she's here today or not. I think she planned to be. She was my hero, I guess. She's the one that put me on the 6-minute test again. Like, it's quite often you get it, a couple times a year, but she did it right the very next time we did the 6-minute test. And then she discovered how much my oxygen was dropping with exertion. So then she put a request in so that I would be tested for home oxygen. So as a result of her good work and being part of the pulmonary rehab program, I was able to get the help I needed. And you feel a whole lot better when you're getting, just like if you're taking your pills and your puffers or whatever you need. The oxygen was a real good thing, I guess, for it to happen for it to be prescribed, I should say. Nobody wants to be on oxygen. Nix that. But now that I'm used to it, it's been several years now, I should be used to it. It's a lifesaver for me. So I guess that's why I wanted to, now that I have retired, I wanted to be able to give back more to Lung Sask, and was able to be placed on the board of directors. And by just sheer interest in wanting to know more, I've spread my wings a little bit within the board of directors. So this pulmonary rehab opportunity to come bring greetings from the board was right up my alley, I guess you'd say. So I don't want to take up too much time, but I do want to mention one more thing regarding pulmonary rehab. And as we know, COVID pretty much messed up everyone's lives and our rehab program, which, in some ways it was kind of nice not to have to go out 3 times a week in the middle of winter. But at the same time, I cannot tell a lie. I was not going downstairs to my treadmill either. So, I mean, I lost ground, and I know that. But I can see that he's here today. I wasn't sure if he'd be able to make it, Dale, but I wish there had been a Dale in Prince Albert back in 2020, because I understand there was how would you put it, like another option available in Moose Jaw to pulmonary rehab. Now, I don't know if it's ongoing or if it was just a temporary thing. And once again, I'm not going to tell his story. I'm not going to tell Dale's story, but because he is here, and I assume you will be speaking at some point during this afternoon. Anyways, thank goodness for people like you, Dale. Thank you. And I kind of wish you'd lived here, but oh well, next time. Anyways, please accept, on behalf of the board of directors, a big welcome for joining us today, and I hope you've learned something new. Thank you. Back to you, Jamie.
Thanks, Mona. Awesome. Well, thank you. Dale will have a chance to bring greetings from Moose Jaw in a bit. So I'm just going to go ahead here and introduce Tristan. Some of you may have seen him. He's helped us in the past, and it's been around probably almost as long as I've been around. And he's a certified respiratory educator and senior exercise therapist with the SHA, and has lots of combined experience working with his team at the LiveWell Chronic Disease Management Program here in Saskatoon. He works with lots of clients, right? It's not just respiratory. He works with cardiac and metabolic, like diabetes, and also lung disease. So currently he coordinates the rehab program at the Shaw Center here at the west side of Saskatoon, and his partner in crime, I like to say a partner in crime, but him and Brent works at the field house, and they've been, a team really for quite a long time. So he's passionate about helping people improve their quality of life with exercise, and we're so happy to have you again here, Tristan, and I'm gonna hand it off to you.
Thanks, Jamie. Thanks again for having me back, and thanks to everybody who's on the line. Just double checking that everybody can hear me and see me okay. I'm getting a little bit of lag on my end here. Seems okay? Perfect. I'm just going to share my screen here. And is that coming up okay? Perfect. Okay, so so just to get started, and kind of very similar to how Jamie started us out today, but just wanted to acknowledge that I am presenting on Treaty 6 territory and homeland of the Métis, and we pay our respects to our First Nations and Métis ancestors of this place and reaffirm our relationships with one another. And again, yeah, invite everybody to explore whatever area they're coming from today, treaty territory they're in as well. So I just wanted to start off with labeling some objectives, and I might bounce around a little bit with some of these. But I thought for the purpose of today, really coming at you with what is pulmonary rehab. So to understand what it's about, kind of who it's for, who attends pulmonary rehab, so why you should attend, or maybe if you're a healthcare professional, why you should refer. And then ultimately understanding that a bit of how exercise plays that vital role in rehab. And then I'll talk a little bit about our Saskatoon programs, and that'll kind of nicely tie us into talking about some of the other programs throughout the province as well. So I wanted to throw this out there first, that it is more than just exercise. So I think when a lot of us hear pulmonary rehab, either as a client, potential client, or an exercise or a healthcare professional, we naturally think of exercise as an exercise program or exercise as being the main component. And it is a very large component, but it is more than just exercise. So pulmonary rehab is recommended. It is evidence-based and is comprehensive intervention for patients with chronic respiratory disease, largely who are symptomatic and having difficulties with their activities of their daily lives. It is for really anybody that has any sort of lung issue. I'll just kind of make it fairly broad there. So generally we do see a large percentage of our attendees have COPD, but we do see others with interstitial lung disease, asthma, cancer, and probably more recently starting to see some of those long COVID people being referred to the program as well. But really, we won't turn away anybody that has some sort of lung thing. So it is comprehensive, like I mentioned a couple of slides ago. So we do take the time to sit down with you when you're referred to the program, and we want to get to know you. We want to learn about your health. Chances are lung disease is probably not the only thing you have going on. We do see a lot of people who have heart failure, lung disease, diabetes, and are dealing with more than one chronic condition. So we want to kind of get that big picture and see what's going on with your health. We want to get an idea of your lifestyle. Are you working? Are you retired? Are you on disability? And what does that physical activity look like while you're at work? What does your activity look like during leisure? And do you have any structured exercise going on? So we're trying to gather that history from you. We also want to know what fires you up, what gets you going, what motivates you. So oftentimes it's good to have some goals set out, some reason to attend the program. So we try to set some goals and then maybe a bit of a time frame to look back on. So let's say 3 months from now, what do you want to achieve between now and 3 months so that we can work towards that together? And that's going to be very individualized. Everybody's going to have a different reason to get them out there. For some, it's going to be the exercise. For some, it's going to be the socialization. For some, it's that health education and many other reasons as well. We do some exercise testing as well. Usually that's in the form of a 6-minute walk test, but there are other things that we can do as well. We want to know what it looks like when you're starting the program and what it looks like periodically through different points of your program time. Again, more than just exercise, we're offering education and support. So very important to offer that disease-specific education. That education is going to be quite different whether you have COPD or asthma. We want to help you with smoking cessation. Again, whether it's providing education or referring out to other healthcare providers that can help with that. Same thing with diet. Self-management. So that's a really important piece. And I'll talk about that in one of the coming slides. And obviously exercise is a big part. Trying to educate you about how much, how often, what are the right things to do, and how to progress with that. So that leads me right into exercise. So generally we talk about a cardiovascular component. We talk about a strength training component or a resistance training component. And usually we talk about some mobility and balance exercises as well. And I'll talk a little bit more on that later in the presentation. So self-management support. So what this sort of means for us is trying to help you to take better control of your own health, putting you in the driver's seat, helping you to feel more empowered and to build your confidence. So a lot of our staff have been trained and have some skills in how to support our clients with building their own self-management skills. So think about it as having a tool belt and these skills as being tools on your tool belt. So when you run into problem A, you can start to problem solve and have some solutions around that. The psychosocial support is also huge. And I put peers at the top because I think that's usually a big factor. It might not always be the factor that drives people to get to pulmonary rehab, but I find that it's probably the largest factor to keep people at pulmonary rehab, is finding others that are dealing with, if not the same chronic condition, another chronic condition that have similar hurdles that put them in face for you. So having those peers come together is really important. Having some education and support around counseling, and then working closely with our clinical health psychology department as well. So just throwing out a couple recommendations here. So, these recommendations come from multiple research studies that have gone on and bringing together a lot of the heads that are in this area, the experts that are pulmonary rehab and COPD. These ones are primarily around COPD. So I will just read them out loud here. It is strongly recommended that patients with moderate, severe, and very severe COPD participate in pulmonary rehab. So again, a lot of research has gone into that. It doesn't say mild COPD, but again, lots of benefits there as well. But the evidence is showing for those who are struggling a little bit more. It is strongly recommended that COPD patients undergo pulmonary rehab within 1 month, so 30 days following that acute flare-up. So whether you're hospitalized or not, trying to start that rehab fairly soon after, within 30 days, can really help to improve dyspnea, so shortness of breath, and how you tolerate exercise as well. Okay. Pulmonary rehab within 1 month following that acute flare-up is also shown to reduce readmissions or having another flare-up and reducing that mortality as well. So really, really important to try to get going as soon as you can after having one of those flare-ups. So kind of getting into those benefits a little bit further here, it really helps to reduce that shortness of breath, that dyspnea, helps to optimize the functional status. So thinking about what you do throughout your day or what you want to be able to do really helps you to be able to do that. Reduces healthcare costs, but I'll also add on to that, reduces healthcare visits. Nobody wants to be sitting in the emergency department or staying in the hospital. We have to do that at times, but really we want to try to avoid that for ourselves. We experience so much deconditioning when we spend our time in a hospital bed. Improving patient self-management, and then stabilizing or reversing systemic manifestations of the disease. So what that means is having that lung disease itself, comes with its own issues, but other issues can come from that as well, whether it's gaining weight, losing too much weight, starting to have other chronic diseases that might come with that as well. So really trying to nip everything in the bud. Well, this is probably one of my favorite graphics to show when trying to convince somebody to come to rehab, is the spiral of inactivity. So right at the very bottom is the spiral takes us down towards disability, social isolation. And what we're trying to do with pulmonary rehab is to kind of get away from spiraling down to that. So usually what happens is when you have this shortness of breath causes us to be less active, and that decrease of our physical activity causes us to be deconditioned. And all that really does in the long term is it makes those activities even harder to do, causing even more shortness of breath, even more inactivity and even further deconditioning. So it kind of goes through this cycle towards that disability and social isolation. So that's where a lot of the factors of pulmonary rehab come into play. But that's where the big vital part of exercise training comes into play. So we use exercise to help increase how our body uptakes the oxygen and delivers it to our muscles. And when we do that, we start to improve how we tolerate activity or exercise. And then we see that improved breathlessness. So maybe a little bit less short of breath with activities that we were once having trouble with. We start to build a little bit more energy. We start to have a little bit more confidence, and then ultimately decreasing our anxiety of getting out of the house, going and doing something, or maybe even getting to rehab. So I did say I would get to talking about exercise a little bit more, and I didn't want to spend too much time on that today because we have done that in the past, and we can do that again, certainly, to talk about how much and how often and really dig into that. It becomes its own talk altogether. But on a very high level, big picture, we're trying to encourage people to work towards 150 minutes of moderate to vigorous effort cardiovascular exercise accumulated over a week. So when I first say 150 minutes, usually that seems quite daunting. Some of us aren't doing that, aren't even close to that. And so it seems almost like an impossible feat. But if you think about that, we are trying to space that over a week. So you can start wherever you can start and just trying to build on as you're able to. So you will start to tolerate things by doing it more often, and things should get easier over time. The other key here is that really those benefits are coming from moderate to vigorous exercise. So not a light effort walk that feels fairly easy. We do want to push ourselves a little bit. And there is more information about that we can kind of break into on another time. But physical activity, we want it to get that breathing rate up, get your heart rate up, try to challenge ourselves a little bit and push ourselves a little bit, somewhat still being comfortable, but being a bit uncomfortable at the same time. So that becomes a hard thing for myself as an exercise therapist to call somebody up, invite them to pulmonary rehab. They're short of breath and they're thinking, well, how does this person want me to come to rehab and become even more short of breath? I can't do it. Well, I can tell you that a lot of people come out and they shock themselves what they're able to do, what they're able to start with, and build from there. So just some quick examples of what I mean by cardiovascular exercise. Those are things that are fairly repetitive, fairly continuous, like walking, riding a bike, maybe rowing, doing some continuous dancing or swimming. Strength training, also another very important thing to do. And for some people, that might be the first place to start. So the recommendations of strength training is to try to do this at least twice per week. Hard to kind of put a time frame to this, but really what we're looking at doing is trying to do some exercises with our large muscle groups. We're performing some movements against a resistance. We're trying to get a bit stronger, trying to build up our muscular endurance a bit. Some people might use their own body weight to do these exercises. Others are using free weights. Some are able to have access to machines, and some have some of those elastic sort of bands as well. So there's lots of different ways that you can do this, lots of different formats, and there's not necessarily one way that would fit all for everybody. But trying to not just do one of these things, trying to have a combination of cardiovascular exercise and strength training is really what research shows that we really need. And very important to do some mobility, flexibility, and balance exercises as well. The cardio and the strength training are super important, but if we have a very high risk of falling down and hurting ourselves and chance of spending time in a hospital bed or laying up on the couch, then we're not moving at all. So we want to try to help with these aspects as well. And these are things that can really be done every day, but they help us to move our bodies a little bit easier, less chance of pulling our muscles. They help our joints to move in a better way. They help us with our posture, and they keep us on our feet. So again, going back to some recommendations by research and by experts. aerobic training and resistance training, like I mentioned earlier, is more effective than aerobic training alone in improving endurance and functional ability. While aerobic training is the foundation of pulmonary rehab, it is recommended that both aerobic training and resistance training be prescribed. And again, this recommendation was done with research on COPD patients, but I would probably gather that that research would show that for others as well. We see the very same sort of evidence for patients with diabetes as well. Another recommendation is recommended that longer pulmonary rehab programs, so beyond 6 to 8 weeks duration, be provided for COPD patients. So in our program in Saskatoon, we really don't have a time-defined program here. People who start our program have been attending our program for as long as 20, 30 years. And this is one of my real big personal beliefs is exercise is really like medicine. So really to try to adopt that in our minds, think about it as another prescription that your healthcare providers have given you. So just like any medication, medications have a dosage and usually they have a frequency. So a puffer, you might be taking so many puffs, so many times per day, and that medication usually has an amount like a milligrams or milliliters or something along those lines. Exercise is very similar as well. So to really get those benefits, you need to be doing so much, so often, and that regular adherence is key. So when we go back to that 150 minutes, we don't want to just go for one session on the weekend and do one big long bout of exercise. We want to space it out. We want to get those benefits nice and evenly throughout the week. We don't want to do that workout really hard for a couple times and then maybe come back to it a few months later. We need to try to develop that into our lifestyle. So step one is to start with something, just something. Start with something. We want that to feel good. We want you to feel great after doing the activity. Every so often, you maybe adjust that. You do a little bit more as you tolerate it, and then you'll find that in no time you'll be able to build your capacity. So we want it to enhance how you feel. We don't want you to go and do an exercise session and go home and be so exhausted that you can't do any of the other, whether it's chores that you have to do, whether it's some of the fun things that you have going on in your life. We want it to enhance your life. And so that's where when you work with that healthcare professional or like an exercise therapist like myself, we can really help you to achieve the best of both worlds there. So one of my golden rules that I always go through with my clients is I call it my rule of thumb, and I usually stick my thumb out in their face so they can see my thumb. They usually laugh, and it's easy to remember. And that's the one thing I get them to remember when they go to leave the session that day. And I say, okay, how did you feel after sitting down, coming in and kind of meeting me? How did you feel? And I said, go back to that moment. And that's kind of how good you should feel during your exercise. And that's how good you should feel when you're done your session, including through the evening and when you wake up in the morning. Now, if you're starting something new, yes, you might be a little more tired. You might be a little more stiff, but realistically, you want to feel good. You want to be able to come back to that next session. You need to feel recovered. So it does take time to get to that point, a few sessions, but we're not looking for anything excessive. I wouldn't want you to come to rehab, do a whole bunch of squats, and not be able to stand up the next day because your legs are so sore. Okay. Okay, so this is where I switch gears and talk a little bit more about what we have in Saskatoon. So we do have 2 facility-based pulmonary rehab programs in Saskatoon, one on the west end of the city at the Shaw Center, and then one kind of central to the south of the city at the Field House. And we also, we don't go to anybody's homes at this point in time, but what we do for people who aren't able to maybe come out to the facility or on a regular basis, we'll offer them what we call a home exercise program. So we'll have them come into the facility, go through the song and dance that we normally would on the first few sessions, and then have them do their activity from home or potentially from another facility, and then support them by phone or bring them back. You could come back in for a follow-up session as well. We have specialized staff. We have most of the staff there are exercise therapists. Most are certified respiratory educators. A lot of us have a lot of background in other chronic diseases as well. So we see people who have heart failure, heart disease, diabetes, Parkinson's disease, people who've had strokes or acquired brain injuries. So we are pretty comfortable working with people who've had a lot of different things going on. We usually, for most of our hours, we have physicians that are supervising our program as well, just in the event that we need to consult them, or somebody was feeling quite unwell. So most of our hours, we do have those physicians, and a lot of them actually work in our emergency departments in Saskatoon here as well. We work very closely with our COPD nurses and our COPD nurse practitioner as well. So these nurses will even come out to our programs, spend a little bit of time there getting to know patients, sometimes even bringing their patients out to our program, and that might be their introduction as well, to show them that, it's nothing that's too daunting to kind of get going on. We have emergency equipment there, such as AEDs. We have oxygen for clients to use on a regular basis, emergency oxygen as well, and a lot of other pieces of equipment to monitor people's vitals as well if needed. We have these nice pieces of equipment. There's that recumbent stepper that's up on the top left of the screen. So those are sometimes a good starting point if walking is too difficult. Getting into the building would be maybe the first challenge, but if we can get through there, getting onto one of these machines and doing some light cardio, just to kind of start building up that base. And then a lot of our facilities will have these arm bikes as well, trying to get some of that upper body work also. So your experience. So if you were referred to Pulmonary Rehab in Saskatoon, once we receive that referral, your referral is triaged to the appropriate location. So likely, unless it's indicated, we're kind of looking at your address, figuring out which is closer for you. We'll give you a phone call and book you in for your first appointment. And we've been doing most of our first appointments actually by telephone to save you a trip. So something that's actually come from COVID. But we can do it in person as well. And we get to know you kind of like I did at the beginning of the presentation. We get to know your health. We get to know what your activity history has looked like. We set some goals. We talk about your medications. And then we'll book you for your second appointment, and you would come in to do your exercise start. We'll monitor your vitals. We'll go for a bit of activity. We might even do your walk test on the first day or one of the second or third days. And then after that, most people are doing ongoing participation, aiming for about 3 times a week. In the winter, we offer up to 5 mornings a week that people could come. And everybody's a little bit different. Some are coming once a week, some are doing twice a week and doing a little bit more on their own. Most are doing a cardiovascular component. We have group exercise training, where some people like to do their own independent exercise as well. And then we try to have some education sessions seasonally as well. Because we work with people with multiple comorbidities, some of these sessions might be geared a little bit more towards diabetes or heart disease, and some of them will be geared directly for people with lung disease. But we'll also have lots of topics that are for everybody. So we'll have some general topics about diet. We might bring a social worker in, or we might bring somebody from the local shoe store to talk about footwear as well. And as mentioned before, we are not a time-defined program. So you start the program and you can stay in it as long as we're running the program. And so we've been doing that for many, many years. I will mention too, there is a cost to our program as well. So most of the cost of the program is subsidized by Saskatchewan Health Authority, but we do have a $30 per month fee to help cover some of the additional costs. And for those who aren't able to afford it, we do work with them to help them get that covered as well. But that is that. And referral is actually quite simple. If you're a client who wants to participate in pulmonary rehab, honestly, the quickest thing you could do is give us a phone call, talk to myself or Brent, who are usually at this phone number, or leave us a voicemail, and we'll get things rolling for you. So you don't need to necessarily go to your physician to get that referral. But we do take referrals from our physicians, really in any kind of form, but we do prefer when our healthcare providers use this common referral form that we have. listed here. And that brings me to questions.
Tristan, I'm going to get you to stop sharing your screen and then maybe pass it on. Let's start with the North and go first. So we're going to get the North Battleford crew to come on, if you don't mind. I think Robin and Blaine are online.
Hello, can you hear me?
Hi, Robin.
Hi. Yeah, so I'll tell you a little bit about the North Battleford program. We run it kind of concurrent with our cardiac rehab right now. It's 3 days a week, so we have mornings and afternoon sessions available that people can choose. And we're located at the Field House in North Battleford for exercise, and it's free of charge, and we are about a 12-week program, but if needed, like, you can definitely stay on longer, and we're not going to discharge you if you're doing well with the program at this point. For education, what we're providing right now is individual appointments with myself or Blaine, the respiratory educators, about COP management, breathing exercises on top of what you're doing in the exercise program, and inhalers, technique, that kind of stuff. We also do visit the program quite often and can provide some support for education at your exercise sessions as well. We're not currently running classes. We have been in the past. We're just not currently doing classes because we don't have a space to run the classes, and hopefully in the new year we'll be able to set that up again. Yeah, that's about it. Anything else I should say, Jamie?
Just wondering if it's open to anyone with any lung diseases.
Yes, open to anyone, self-referral, doctor referral, open for all, yeah.
Right. So Robin and Blaine, who is there somewhere, are both the chronic disease nurses in North Battleford. That's the right title, correct?
Correct.
Yeah, and our COPD educators as well. So thank you very much. Appreciate that.
Thanks. You're welcome.
Great. So let's move to our next Robin in Prince Albert.
I am here. Sorry, my computer's giving me some issues here. So hopefully I stay on long enough to get my little spiel out. So our program, again, hit by COVID like everybody else. It did have some drastic changes to it. So we used to be like Saskatoon, where you could come and just keep coming and coming forever. But now it is reduced to a 12-week program. Again, 3 days a week, and open to everybody, doctor, self-referral as well. You know, we have a handful of people attending. It definitely could be much, much more and a lot bigger. We are kind of limited to 20 people in our sessions at the moment. Everything's spread out. So, you know, as always, I don't know if COVID is going to be a factor in hindering people in participating, but definitely, you know, hopefully reassuring people that things are spread out, cleaned off, and we actually have to wear masks when we do our program. I don't know if everybody else does. I didn't hear if Tristan is at Saskatoon. It is exercise-based, obviously, as well as, you know, mainly one-on-one education as needed, on the spot sort of thing. We're not doing any classroom education at the moment, as some of the programs probably are doing. And yeah, it's, you know, kind of going along, and hopefully it grows as COVID gets farther and farther away from us, and more people actually take advantage of it. It would be great. I don't know if there's anything else that you wanted me to add.
Is there any cost to your program?
Oh, sorry. Yeah, no, it's free at the moment. Okay,
great. Thank you very much, Robin. I'm glad you made it through that.
Yeah, me too.
Let's see who would be next. Let's go with Carrie in Yorkton or in Melville.
Hi, Jamie. Can you hear me?
Yep, sounds good.
Yes. Hi, everybody. My name is Carrie O'Donnell. I'm a registered nurse and a certified respiratory educator that works with the Pulmonary Rehab program in Yorkton and the surrounding area. I have my mask on because sitting next to me is my coworker, Marcy Eskra. She is our exercise therapist that works with the program as well. So our program, I think, is fairly similar to what's being offered in Saskatoon right now. We've been running our program for about 12 years now. Pre-COVID, we've been running in 2 locations. We were running out of Yorkton and also out of Melville. Of course, like everybody else, we were shut down all through COVID, and we actually just restarted our programming this fall in Yorkton. And we're not quite sure if we're going to be in Melville in the new year or not. We're just going to have to see how things go. Our program runs twice a week. It's staffed by at least every session has 1 registered nurse. Oftentimes it's 2, and our exercise therapist. It's open to anyone with any type of lung condition. Referrals can come from physicians, nurse practitioners. It can be a self-referral. Prior to coming into the program, we like to sit down and have a one-on-one appointment with people just to kind of get to know you a little bit better and where you're at. Cost for the program, in Melville when we were running it, it was free. And in Yorkton, the cost is $3.05 per session, which is paid directly to the facility that donates the space to us for the use of the walking track. Like Saskatoon and probably some of the other programs, we have a variety of equipment. We have a large walking track, we have recumbent ellipticals, we have arm ergometers, so we can accommodate people that maybe have orthopedic concerns, right, and aren't able to just do a lot of walking. Anything else? Oh, education. We offer education in a group setting and also one-to-one. And also, I guess, actually traveling into a group exercise program or education classes doesn't work for everybody. So for those people that doesn't work for, we can also do just one-on-one individual appointments, sometimes ideally in person, but we can also do them over the phone. And I guess just also to mention that at our program for people that are on oxygen, we do have oxygen tanks and concentrators that people are able to use while they're at the program, so they're not using their own tanks. Anything else you think people would want to know, Jamie?
No, I think that's it. And you said it's a 12-week program?
It varies. It's a minimum. The very minimum we want people to kind of commit to is a 6-week. Our fall program is probably our longest program. It'll go from September right up until Christmas, right? So if people want to participate that whole time, they can. And I guess like Saskatoon, ours is not like, it's not a defined time. People can keep coming back as often as they want.
Good to hear. That's awesome. I'm glad you guys are back up and running.
Us too. Thank you.
Yeah, thank you. Okay, I guess let's head to Regina. Is Laura still around?
Hello. So I'm Laura, I'm a respiratory therapist in Regina and a CRE. We currently are running 4 programs in Regina, one in each of the primary health networks, so we can make sure that we're close to where people live. Each person can be either self-referred or referred from any health professional or from a family member just by calling an intake number. But we also have a referral form for health professionals. We are automatically connected with a respiratory therapist that is a CRE, and we just make sure you have we have a little bit of background, make sure you have everything you need to start the program. And then our exercise therapist will reach out, do an initial assessment. You're put into a 12-week program. If you're not able to get to the facility, we do have the option of the exercise therapist going into your home, doing an assessment and building a home-based program for you. All of our sessions are free. We run twice a week at different days of the week so that we can accommodate for people, and maybe if they have to travel outside of their neighborhood, we can get them into a program that fits the day that they need. And after the program is done, if we are trying to get people into our maintenance group, but if the group sizes are too big, we're connecting people with our Forever Emotion programs and that kind of thing. Yeah, and we run education sessions. So it could be that one of the respiratory therapists come in to do a session about different topics, or another health professional regarding, say, advanced care planning, anything like that, or home care needs. And we run concurrently with our diabetes wellness program and soon to be a cardiac program.
Enjoy Laura's down south, so she's enjoying the warmth, I hope, right now.
It's warm.
Oh, lucky you. Thank you. And I think lastly, I think the last is Dale in Moose Jaw.
Hi, Jamie. Unlike the other, pardon?
You're going to report on the program and your experience, right?
Well, unlike the others, I'm a client rather than an employee or a respiratory therapist. But pre-COVID, Moose Jaw was very similar to what Tristan was saying of Saskatoon. And post-COVID is almost, from my understanding, the identical of North Battleford. It's run at the Wigmore Hospital. It's a one-on-one session. There's no group sessions, which at the moment, although they are trying to find a facility, basically everything has been covered is the same, and we definitely need to get back into the group session where as Tristan mentioned, the peer program is so huge, and the social aspect of it. As Mona talked about earlier when she spoke, when we did our program here in Moose Jaw, was the social aspect of it was so huge that when we did have COVID, we ran one out of my backyard and then into my garage as best we could. I mean, when the programs quit. Again, we had phenomenal support from everyone, and it worked well. Hopefully now with the post-COVID, that the programs get back on track and that we can get going again. And just all the things that have been said today are just so important that we just have to get back and get doing them. And Tristan's program is incredible. Everything on it, we highly endorse as years of experience in doing it. But anyway, that's pretty much all I have, Jamie.
Thank you, Dale. If you haven't seen, he's also, well, he's got a beard now, but in this picture, there's no beard, but Dale's a fantastic ambassador for LungSask, and we appreciate all the work you do for us. And whether it's driving around, dropping off equipment, or if it's taking pictures and doing some advocacy. So we really appreciate all you do, Dale. I think everyone can see my screen with the website here. It says find a pulmonary rehab program. So if you look, all these towns or cities in Saskatchewan will all be an option here. For example, if I pick on Saskatoon, the Saskatoon programs will come up. You'll see, look, there's Tristan's name, the phone number, and that's how you can find out more information. But that's your best resource to find out some of the other programs in the province. Just want to thank again you, Tristan, for being here and doing this presentation again. And obviously lots of comments. We're connecting everyone in the community, which is fantastic. I hope you can come back again sometime. And thank everyone else for sharing their locations information. And please, yeah, just reach out to Lung Saskatchewan or anyone on that website that I shared who might be able to help you breathe a little easier.